I was 15, almost 16, when I went to CAMHS in Peterborough. I was diagnosed with OCD, intrusive thoughts and depression and was given medication. As I got nearer to 17, they started talking about me being discharged. Just before my 17th birthday, we met with CAMHS and they spoke about referring me to adult services. I wasn't sure about having a new team, so said I would think about it. When I went back for my next appointment, I was told it had been decided to discharge me, and my GP could refer me to adult services if I needed more support. As I was young, I agreed and didn't realise what was ahead of me. I took a real dip a few months after being discharged from CAMHS. The thoughts were really bad and dark. I was hardly sleeping, I was self-harming, restricting my diet, and I couldn't concentrate on my A-levels. My GP increased my medication and said I had to self-refer to the IAPT service. I didn't hear anything from them for a few months, and by this stage I couldn't study and decided to go back a year. I had a telephone assessment and then waited 5 months. At my first session, I was told I wasn't suitable for their team and they would refer me to another service. This took another 6 months for an appointment, and this was then cancelled twice. By the time I had my appointment, the thoughts were really strong and I was harming almost every day. I got the same diagnosis as CAMHS, but no plan on how they could help me. I was put on another waiting list, and by this time I had left college as I couldn't continue. I didn't see my friends, spent most of my time in my room, my parents decided to find me private support, and I finally had someone to speak to. My NHS appointment came through over 4 months after my assessment, so in total I waited almost 2 years. There were times during my low periods I felt no one was listening to me, and it felt like I was going around in circles. I couldn't see a future, and some days I struggled to see if I could make the next day. I'm still experiencing low mental health. I want to now talk about my experience as the system needs to change. I wasn't ready at 17 years to be an adult. Only now at 26, I feel like I can make real choices in relation to my mental health.